purpose of this film is to help you minimise the risks from Covid-19 and other similar viruses while you're at work. Please follow these guidelines to prevent the spread of the disease and protect yourself and those around you from being affected. By doing so, you can play your part in ensuring that we can continue to help the most vulnerable in our community during this crisis. Covid-19 is an unpleasant flu-like illness caused by a new virus. The illness usually lasts 7 to 10 days in healthy adults, causing a range of symptoms, and in some people, no symptoms at all. Here are some of the main signs to look out for in yourself and others. A new, continuous cough that results in at least 3 episodes of coughing over a 24-hour period. A fever of 37.8 degrees C, where you feel hot to the touch on your back and chest. A runny nose or sneezing, and in children, diarrhea and sometimes tummy pain. For those severely affected, it can lead to breathing difficulties and pneumonia. The virus that causes Covid-19 can stay alive on plastics for 72 hours, on stainless steel for 48 to 72 hours, and on cardboard for around 20 to 24 hours. And it's easily transmitted, usually either when a person breathes in microscopic droplets that are being exhaled by an infected person, or when they touch an infected object or surface and then touch their face, mouth, nose, or eyes. In order to minimise the risk of contracting or transmitting Covid-19, there are 6 things that we must all do. Number 1, isolate. If you have any Covid-19 symptoms, you must not come to work. You must stay at home and self-isolate for 7 days, or 14 if living with others. Number 2, keep your distance. Keeping a safe 2-metre distance from other people minimises the spread of the disease. So if you can carry out your work remotely, for example by phone or video call, you should do so. You should only be travelling to work with others if you absolutely have to. If you do need to travel to work or work on site with other people, then you must do the following. Keep a distance of at least 2 metres between yourself and the other people at all times. In vehicles or other closed spaces, open a window to create airflow. Stagger your shift changes to reduce the number of people in a space at any one time. Organise your working environment so that everybody can keep a safe 2-metre distance. Number 3. Delay contact. The virus can live for up to 3 days on surfaces, so leave all objects that you're unsure about to one side for 72 hours until you use or touch them. Number 4. Wash your hands. As you're probably already aware, hand washing is a key tool in the fight against Covid-19. Washing your hands for at least 20 seconds using soap and water, or at least a 60% alcohol-based hand sanitizer, should be done regularly throughout any on-site shift. As a guide, you should wash your hands first thing at the start of each shift, on returning after leaving the building for any reason, before eating, after touching your face or other objects while packing or on delivery runs, after bathroom breaks, or handling other frequently touched surfaces or objects, before you leave the shift at the end of the day, and first thing when you get home. In addition to hand washing, where possible, you should try to avoid touching objects where you can instead use your elbows, knees or feet. This especially applies if you're out doing deliveries. Number 5. Cleaning. The virus that causes Covid-19 is killed by detergents, including soap and water, and most common disinfectants, including bleach. Here are some specific guidelines on what you should be using for cleaning surfaces. Use a detergent and water-soaked cloth, followed by a disinfectant. If you're using a bleach-based solution, make sure it has a chlorine content of 1,000 parts per million. If you're using an alcohol-based solution, make sure it has an alcohol content of 60%. Don't use baby wipes because they're ineffective against the virus. Make sure that you clean busy and frequently touched areas like door handles, door pushers, telephones, steering wheels, gear sticks, seat belts, toilet block doors, and flushers at least 4 times a day. Any vehicles that are used should be cleaned before a shift, after a shift, and between a change of driver. If you work in a high-risk area, you should clean your clothes after each shift at a temperature of at least 60 degrees C, making sure that they have dried thoroughly before wearing them again. Number 6. Personal protective equipment, or PPE. Personal protective equipment to help prevent the spread of COVID-19 may include gloves, face masks, aprons, or visors. You don't need to wear PPE in every situation. As a guide, if you're preparing food, you must wear a hairnet and gloves. If someone becomes unwell at work and shows symptoms of COVID-19, they should wear a mask until they're able to leave. Make sure to fit the mask correctly. If you handle public donations as part of your work, you should wear gloves. If you observe the distance and hand washing rules, masks are not needed for delivery runs. You must, however, take hand sanitizer with you to use in case you have to touch objects like doors and gates. If you don't have hand sanitizer, then gloves must be taken to be worn instead. Remember, however, to remove them before handling the delivery itself. Gloves should not be used to carry boxes or hand over deliveries. If you bring your own mask to wear on shift, please be sure to wear it correctly, covering your nose, mouth and chin. Make sure you remove gloves for breaks and put on a new pair of gloves every time you start a new task. And finally, be sure not to use your teeth to put on or take off gloves, or for any other workplace process. By following these guidelines, we will help ensure that we minimise the impact and spread of COVID-19 in our community and safeguard the very people we're trying to help. You can find out more at these links.